Hello, I'm Caroline Fairchild, and welcome to LinkedIn News Live, where the business conversation begins with you. May is Mental Health Awareness Month, and today we want to focus on what that means vis-a-vis the workplace. 15 months into a global pandemic, everyone is re-examining their relationship with work and its impact on emotional wellness. Burnout has become so ubiquitous that there are increased calls for it to be considered a medical condition. Both of our guests on today's show are experts in mental health as well as burnout. Diaris Alexander is our first guest. She's the founder of InWealth, a consultancy that designs strategies to help high achievers deal with burnout. She received her MBA from Emory University and spent several years in corporate America, developing talent after 10 years in the social impact space. Diaris, thanks for coming on LinkedIn News Live.
Hi, happy to be here.
And joining us as well as Dr. Marra Ackerman. She's joining us from the psychiatric unit of NYU School of Medicine, where she got her doctorate degree. She spent several years at Columbia University's Department of Psychiatry and New York State Psychiatric Institute. Marra specializes in stress, depression, anxiety disorders, and OCD. Marra, welcome to LinkedIn News Live.
Thank you so much for having me.
All right. LinkedIn needs you two right now. I cannot tell you how many of our members are dealing with some of the issues that you both are experts in, particularly given that we're 15 months into a global pandemic. So I so thank you for joining us on the show. And if you're in the stream right now joining us, we know that this is something that you care about. So let us know your concerns, your questions. These are the people to answer them. So if questions on burnout, on stress, on anxiety, let us know in the stream. We can have a conversation about that on today's show. Dr. Ackerman, I'll start with you. I'm curious, at the beginning of this pandemic, were you aware of just the outsized impact this is going to have on your practice, on the issues that people are going to be experiencing going through this crisis?
I think, like so many people, that in March of last year, there was no way to have an understanding of the magnitude of what was coming. I remember, our office even starting to make plans to think about how we would manage if patients were potentially exposed to COVID and how we would change office practices. And it seems like a century ago, because the way that our lives and our clinical practice has changed has been so dramatic. So no, I don't think so.
And Diaris, was burnout top of your mind at the beginning of this pandemic? Did you think that it was something that was going to lead to just a total rethink of how people think about work?
Yeah, burnout's always top of my mind. I mean, I grew up as an overachiever, and so many of my friends, whether it's through, my MBA program or undergrad or everything that I do, are ambitious. And so for me, it's always top of mind to care for the people in my life and to care for the people that are driving impact in our communities. And I know that they're most susceptible to burnout.
Well, burnout is top of mind for a lot of people on LinkedIn right now. One of the reasons we wanted to bring you two on is that there was a study that came out recently from WHO that showed just the devastating impact that this is having right now and the cost of overwork right now as people are working from home. I think we have a graphic to illustrate that right now in terms of if you're working up to 55 hours a week. They discovered that in 2016, this led to 745,000 deaths. You're 35% higher risk of a stroke and 17% higher risk of dying from heart disease. Dr. Ackerman, this findings from 2016, but a lot of people are overworking right now. Is this a concern to you as you think about how people are working through this pandemic?
Absolutely. And I would say, so my experience with burnout prior to the pandemic is really around physician burnout. So for a number of years, I led our efforts for our house staffs, our residents and fellows and medical students. And so there's a lot of literature around burnout among doctors. But I think what the pandemic has really highlighted is that burnout is a condition that can affect all sectors, can affect all people, and that this current climate of working from home, trying to juggle home life, work life, and not being able to have a separation is putting people at risk at burnout across the board. And certainly burnout does confer other morbidity in terms of both psychiatric and physical health problems.
And have you been treating physicians through this crisis, given just and what has that been like? Have there been different symptoms? Has there been an increase in what they've been experiencing?
So I've treated physicians for a number of years now in my practice. The area of interest of mine is how to support colleagues as a psychiatrist. How do we take care of our own? Our practice at NYU, we serve our own community. So our faculty practice takes care of people who work in the NYU Medical Center in all different sorts of roles. So nursing in could be in security, could be working in the cafeteria, could work in any facet of the medical center in addition to doctors. And I've worked in that practice for the last 6 years. And so certainly at the peak of the pandemic last spring in New York, we were seeing people just in crisis, right? So largely symptoms of insomnia, anxiety, more so than I would say depression and burnout at that point. And then of course has evolved over the course of the pandemic, where I think there has been more post-traumatic stress, depression, and burnout as we've gotten further and further along the way into the pandemic.
Mm-hmm. And Diaris, from your seat, what are you seeing through your consultancy practice? At this point in the pandemic, have employers or managers figured out how to manage burnout that they're seeing?
I think one, everybody just is more compassionate. Like, we're going through this all together. So I think now's the perfect time for us to think more strategically and holistically about what we can do to change the culture of our organizations. Because burnout, it could seem like it's just an individual problem, whether, you're getting extra anxious or you're just exhausted, you have the cynicism related to your work, or maybe you're feeling less effective. But now we have both the opportunity to help individuals and how they're dealing with their symptoms, but also building a larger awareness into the thread of organizations. And I think there's a much larger appetite for that now that the pandemic has hit. And we're seeing people working on average 48 and a half minutes extra per day. And that's putting everybody in additional occupational risk as well.
Well, Diaris, I'm seeing a ton of members in this stream right now saying that they also have an appetite to change the conversation about this. We have Julia joining us from California, Colleen from Nevada, Lisa from North Carolina, and Yolanda from New Jersey. Thanks for joining us here on LinkedIn News Live. All right, Dr. Ackerman, this is a question I need an answer to because I'm struggling with some of these symptoms myself. But how do you diagnose burnout versus, say, I don't know, panic or depression or some of the other symptoms that may come up when you are having a rough time at work?
So it's a really important question, and they are quite different. So I think of burnout as having a lot to do with loss of meaning and purpose, right, in what you're doing. So if you're burned out at work, right, that the work is lacking in some way the meaning that it had in the past, and that can lead to symptoms of fatigue, symptoms of feeling bored, underappreciated, sometimes maybe even anger, difficulty sleeping. You could have, physical symptoms that overlap with depression and anxiety, but I think the core difference is this sense of loss of purpose, where if you think about other like depression or anxiety themselves, these have circumscribed symptoms that we have, the diagnostic manual in psychiatry to assess and diagnose, and burnout really is different from that.
And we have this question here from Michael that I want Diaris to address right now. He's asking us in the stream, is a toxic work environment that causes burnout, or is it just overworking?
I think it's a combination of both. So a toxic environment can make you overwork because it might, exacerbate or amplify imposter syndrome, where you feel like I need to go harder at my job. I really need to hit the grind. I'm doing everything that I can. And then those things, largely when it's built into teams and leaders or are changing recognition around that overworking and things are seeming unfair, that becomes more of a toxic environment. I think it's all of our responsibility, whether we're leaders or not, to adjust our work culture. Like, we have to set our right boundaries. We have to do what we can to be aware of what's going on. And to also remember why we came into a role or why we want a job in order to have the kind of lifestyle and outcomes we want for our families.
And speaking of workplace cultures, I actually want to bring up a comment that we've had on LinkedIn on this very topic from Amanda, who said that she was in Switzerland for some time, and she said it was an eye-opening experience. She said when she was in Switzerland a few years ago, how different the working cultures there were. Late starts, long lunches, time leaves, and very little work over the weekend. And for American on a temp assignment, it took a while to get used to. How much of this is so ingrained in our culture that we almost don't have a fighting chance here? Is this something that we can really fix, especially at this point in the pandemic?
Well, I think we can fix it. I'm always going to be the optimist, because I'm going to take accountability, right? I'm going to go into what I can do from working with leaders so that they can feel more empowered to do this, but also so they can build cultures that support them in changing the habits of their employees. I think if anyone saw Emily in Paris on Netflix, which was a big hit last year, she talked about the same thing. We saw how drastically different other cultures can be. But I think once we have it larger in the conversation, we can have a greater awareness so that we can take action on that. So I definitely think that we can move forward for sure.
And Marra, I see a lot of managers joining us in the stream right now. And I want to know, you mentioned some of the symptoms of burnout, but if say you're a manager, you're the leader of an organization, are there ways that you can kind of sniff some of these things out or see them in your employees for those who are struggling and may feel like they can't ask for help?
Sure, I have a couple of thoughts on this. So one, I agree with Diaris that we have an opportunity here actually to address burnout. And I think in a lot of ways, the pandemic has built perspective. And I think that now, especially as we start to consider return to work, we have opportunities to be flexible. We have opportunities to talk directly with employees and think about how we can make that return meaningful and how we can learn from this pandemic in terms of work-life balance and in terms of what we do and what we expect and how we set expectations for our employees. So I wanted to say that first. And Caroline, if you could repeat to me again the second question that you asked, because I just wanted to comment on that first from Diaris.
Yeah, no, I think that hits on exactly what I wanted to talk about. But this question from Stephen, I think, is where we should move the conversation now. Look, there are a lot of employees who can have these conversations with their manager, maybe take some time off, maybe work from home more, but there are a lot who don't have those options. Yeah. Stephen's talking here about essential workers, hourly workers. How do they combat these issues when the hours that they work may not be necessarily in their control or where or when they work?
It's incredibly difficult. And I think recognizing the inequities here and the fact that there's going to be disparate access to flexibility across different sectors, across different socioeconomic, type jobs, people are not going to all have equal access to this. And that's really problematic because it could lead to burnout being felt disproportionately in the underserved. And so I think that there's no easy answer here, but I do think you can decrease burnout by also talking directly and validating these experiences, by validating the fact that it's frustrating to have worked from home from a period of time and now be expected to be back on an arbitrary date, to have to go back to not being home when your kids get off the bus, and not being able to see them because now you're back in the office. I think being able to be supportive and have these conversations and not ignore and sort of say, okay, it's like a rubber band snapping back to usual business as usual, and we're just gonna, rebound. That's not reality. We have all survived this trauma together. And so I think even if you can't change the arbitrary nature of structure, you can still change your attitudes and you can still open the door to have these conversations.
I love that idea of validating the frustration. I feel like just doing that more often can do a lot in terms of helping to name the problem and try and get some of the root causes. Diaris, I saw in your work that you talk a lot about burnout as a cycle. Can you walk us through are there different stages? Is it kind of like the 7 stages of grief when it comes to burnout? And if you hit a certain part of the cycle, is it almost too late?
I'm never gonna say it's too late unless you're like exhausted and like literally on your deathbed. So that's pretty much the final stage, is this physical collapse where people get these health outcomes that really brings them to urgent care. There are a lot of other steps and stages. I did a 12 stages of burnout leading up to Christmas because a lot of people are also hit with the emotional pieces of the holidays and the pandemic, and it felt like something I wanted to address. So yes, it looks like excessive ambition, it looks like depersonalization, it looks like having a work-only focus, it looks like extra anxiety, maybe using alcohol or drugs to kind of get you through and do that. But I also wanted to comment on what can we do and how can we adjust it, because it really is important to be very specific and explicit that this is impacting some populations more than others, and it's not a level playing field. So I think it's easy to say that when we're looking at women and mothers working from home and also dealing with, virtual school and the additional hours that they're working just to maintain that and to switch between assignments. And we're looking at the cognitive load and the emotional labor that it takes to deal with that. And, with the anniversary of George Floyd, just his passing 2 days ago, I think we're seeing that people in the Black community are also impacted differently. I think there are a couple of things that we can do, and one of which I think is a larger conversation that we are having collectively as a society, and that's looking at self-care. And I think it's not self-care Sundays, but it's really what are the micro habits that we're doing to build a lifestyle of caring for ourselves, because that really is community care. So we can then better advocate for those that may have less power and resources to need it.
Well, Diaris, I'm so glad that you brought that out, because one of the biggest changes that we've seen throughout this pandemic is employers no longer being able to pretend that everything that happens in an employee's life outside of the office didn't exist. We have all these societal issues that now employers are having to voice. From your seat, is that helping the mental health of employees? Are workplaces moving in the right direction when it comes to, say, acknowledging that systemic racism is something that shows up in the workplace, acknowledging that sexism is something that leads to burnout, leads to decreases in mental health for employees?
So I think we're kind of at the messy start right now, if I'm honest, because if I'm talking to people that are women of color, especially, they are having these conversations, and it's really going to sort of one of the 6 pieces of burnout, which is about values alignment. And so now many people are finding that the companies that they work for are not actually aligned with where they want to be. And we're seeing that with Basecamp in the news, for example, about not talking about politics. And I think that it's creating a tension that is difficult for a lot of people to deal with everything that's going on. But I think it is a healthy tension that's a step in the right direction, because we do definitely have to have an awareness in order to then bring the right attention and the action that will ultimately change the environment.
And Dr. Ackerman, I'm curious how this shows up in your practice. I'm assuming that when patients come to you, you can prescribe lifestyle changes, you can prescribe medications perhaps, but do you ever prescribe like, hey, maybe you're not working for the right company? It seems like the employer is the problem here. Is that something that you have conversations with your patients about?
But I think this can be really a part of psychotherapy in terms of thinking about life changes, right? And again, some of that might be impossible. I think you have to be very sensitive to the fact that, I could say to somebody, this is not the right job for you, and this is contributing to why you're burned out or why you're depressed. And yet there are going to be some people who can't change that, right? They don't have the opportunity to leave their job, right? They can't afford to do that. They can't take that risk. And so I think you have to really be cautious in the types of recommendations that you make. And a lot of it may be about how do you make the best of it, or how do you set limits? So if you can't leave or make a change, which maybe would be the ultimate goal, how do you set limits? How do you communicate with your supervisor? How do you sort of say, this is what I'm capable of doing, and this is what I'm not, no matter what role that you're in order to advocate for yourself? Because I think you can build back meaning and you can build back satisfaction at work by feeling like you're empowered to at least advocate for yourself, even if it's in small ways.
Absolutely. And I think I really want to switch gears and talk about what's at risk if employers don't get this right. If they don't make, I was speaking with a CEO recently who called mental health the 4th pillar that now employees are looking for when it comes to their benefits. It's not just dental, it's not just health. Like, this mental health aspect is something that employees are looking for. We have some stats from Catalyst that kind of point to the cost of burnout and its impact on mental health. Right now, at this point in the pandemic, 92% of workers are reporting burnout. Burnout drops 26% when there are remote options. Burnout drops 43% with empathetic managers, and employees with remote work access are 30% less likely to look for another job. Diaris, I'll start with you. I want to start with this. Burnout drops 43% when you have an empathetic manager. Are you seeing more organizations leaning into that trait when they're putting people into management roles?
I think it's one of the things that different cultures have often put high performers into management positions because they feel like it's the next step. I think now we're seeing how important emotional intelligence is and really what is at stake when we look at numbers like retention. I know when I've managed teams before, it was, unheard of some of the leaves of absences that were really setting records within the enterprise. And it really is because of how I approach working with my team members. I think it's an incredibly important piece to do, because when you have an empathetic manager, you can really talk about what does the self-awareness look like and be much more comfortable setting boundaries or negotiating boundaries, as well as workload with your manager.
Well, this idea of empathy, I wonder how much it crosses borders. Over when we put up the study from WHO about the impact of overwork on the platform, we got this comment from Tarek, who was saying basically, hey, this might be a very Western idea here. There are companies like, say, utility companies that just working fewer hours, thinking about remote work, these just aren't options for a lot of industries. So I guess my question is there, going back to the fact that this isn't an option for everyone. What are things that you can do if, say, the hours that you work are not in your control, or the industry that you're working in is not necessarily allowing remote work, which we know is leading to decreases in burnout?
Well, I think one thing that you can do is on the leadership of the company, right? So there are shifts that we can make because we can see, decreases in, injuries, at a factory, for example. And we can do the same thing as we're doing that. The data is pointing to that we need to, and now we have a greater awareness of all the things that are impacting that conversation. I think if you can't control your hours, you can control whether or not you're going over your hours. You can make sure that you are being compensated fairly for that, because fairness is one of the things, or your sense of fairness and your sense of control is one of the things that impact burnout. And so once you are having these conversations, and we know that labor theft is one of the largest thefts that happen, is because people just don't know. They don't know they should be paid for overtime. They don't know that, they can't be asked to come in early and do beyond. And we really need a worker education in order to help move this forward. And we need leaders that are compassionate about what this means to the community, not just their bottom line.
And Dr. Ackerman, I know that you need patients to stay in business, but I'm sure you're also a proponent of preventative medicine here. So before I let the both of you go, are there things that people can be doing at this point in the pandemic to not get to the point of burnout, to not get to the point in which work especially is just bringing them to a place of just bad mental health?
So I'm going to make a plug for getting vaccinated, which I realize may be somewhat controversial in some sectors. But the reason I'm saying that and bringing it up here is I can say for myself that being vaccinated has opened up my world, and I think has helped me deal with burnout, and the fact that now I'm starting to be able to see family and friends and feel safe doing that. And I think we can't really have a conversation about burnout in the pandemic without thinking about social isolation. So I think the social isolation that we've all had to contend with this year has only compounded the problems of burnout and feeling like all we do is work. And so I think, of course, you have to think about how to keep yourself safe, and, social distancing and, is still really critical and really important. And we need to make sure to protect ourselves, from infection. But at the same time, I do think we need to protect ourselves from social isolation. And I mean that in your personal lives, and I mean that at work too. I think being with your team is incredibly meaningful. I mean, assuming that you get along with your coworkers and it's a good environment, which again is not the case for everybody. But I think maintaining that connection, making sure you're seeing people face to face, and if it can't be in person, then making sure you're doing it over video rather than just audio, it does matter. And I think that we really do have to make an effort to connect to each other, and we have to sort of move forward. And so if that for some of you means you're not ready to get vaccinated yet, again, I still think there's a way to move towards being in touch, communicating, connecting with your colleagues, and that looks very different than when everyone is working on site together in the way we did pre-pandemic.
Well, Marra, I can't think of a better note to end on than human connection heals all. Thank you so much for joining us. Diaris, thank you so much for joining us as well. I see so many members in the stream right now thanking you for your time and for helping us combat issues that so many people are facing at this point in this crisis.
Thanks for having us.
Thank you.
That was Diaris Alexander, as well as Dr. Marra Ackerman, talking to us about ways that you can fight burnout in real time right now at this point in the pandemic and during Mental Health Awareness Month. And for all of you who are joining us in the stream, thank you for your comments. Thank you for your questions. You can continue the conversation and check out other stories trending right now on LinkedIn by going to the right of your LinkedIn feed, or if you're in mobile, you can click into the search box. Tomorrow at 12 Eastern, my colleague Andrew Seaman will have Get Hired. He'll be speaking with Lindsay Pollock on how to plot the next step in your career. You're not going to want to miss that conversation. I'm Caroline Fairchild. Thanks so much for joining us on LinkedIn News Live.